It's peak flu season in India. So if you've had a cough, cold and fever recently, in all probability you had the flu. According to the Union Health Ministry's surveillance data, India has recorded nearly 650 influenza cases since January this year. A bulk of these cases, 494 to be precise, are the H3N2 influenza. As of March 15th, there have been 2 confirmed deaths due to the H3N2 virus from Karnataka and from Haryana, and 1 more suspected fatality in Gujarat. What is the H3N2 virus? What are the symptoms that you should watch out for? Could H3N2 cause the next pandemic? And should you worry? To answer all this and more, I'll be joined by Dr Vijayalakshmi Balakrishnan, Senior Consultant, Infectious Diseases. The seasonal flu is an acute respiratory infection that affects the nose, throat and lungs, and it's caused by influenza viruses. Across the world, flu cases rise in certain months. In India, there are 2 seasons of influenza, one between January to March and the other post the monsoons. There are 4 different types of influenza viruses, A, B, C and D. The H3N2 virus is a subtype of influenza A. It was first detected in 1968 in Hong Kong. In fact, the H3N2 virus was responsible for the 1968 pandemic, which resulted in 1 million deaths across the world. Like other influenza viruses, H3N2 has been circulating across the world and has over the years contributed to the rise in hospitalizations and deaths every time there's an outbreak. Experts in fact point out that H3N2 is usually the culprit for the worst flu seasons. In India, cases of the H3N2 virus have been steadily rising since December 15th last year. Week 1 of 2023 saw 46 cases, peaking to 61 in early February. Over the past 4 weeks, India has recorded 40 plus cases of the H3N2 virus every week. In fact, on March 5th, the Indian Council of Medical Research warned that the H3N2 virus appeared to lead to more hospitalizations than other influenza subtypes. Now, like I mentioned earlier, there have been 2 confirmed deaths due to the H3N2 virus as of March 15th. The first death was reported on March 1st from Allur in Karnataka's Hassan district, where an 85-year-old man succumbed to the virus. The second death was reported from Haryana's Jind district, where a 56-year-old man who was also a cancer patient died on February 8th. So why are we suddenly seeing a surge in H3N2 cases? To find out, I spoke with Dr Vijayalakshmi Balakrishnan, Senior Consultant, Infectious Diseases. Listen in to what she had to say.
Let's see what actually happened and why do we have such a big wave is because generally high risk group gets vaccinated every year. Even if they miss out a year, they get vaccinated the next year also. But what happened because of COVID, majority of high risk group and pediatric age group did not get vaccinated against H1N2, against influenza. Second, 2 years all of us have been in. Schools were shut. Children didn't go to school at all. So immunity is very less. Suddenly there's an explosion of people going to school, markets, theaters, all indoor activities have increased. So which has increased the transmission in a relatively naive population. We have not had H3N2, immunity is less, you have not been vaccinated and you get exposed. So you develop it. It's as simple as that.
As far as transmission goes, the H3N2 virus spreads from one person to another through droplets via air, direct contact or surfaces. But what are the signs and symptoms that you should watch out for?
H3N2 is a respiratory viral infection. That is, like the other viruses, it also produces sore throat, sneezing, cough, cold. Some people, when it becomes a pneumonia, breathing difficulty. So majority of time, it is there in your throat, nose area. So you will have some kind of some burning sensation in the throat, nasal stuffiness. Very few people will have some sneezing, some discomfort. It can be a dry cough. That's how it is. And then fever continues for some time. If it goes on for a longer period of time and if they develop pneumonia, then they have severe cough and breathlessness. Majority of them will have symptoms for 3-4 days with more of sore throat, and then the body ache and mild cough persists for 2-3 weeks.
Now, if you're experiencing any of these symptoms, your doctor may want to test for H3N2. Dr. Vijayalakshmi says that like any other virus, H3N2 is detected using the RT-PCR test with a throat swab of the patient taken. If your test comes back positive, then how do you go about treating the H3N2 flu?
There is an antiviral, but always remember bacterial infection, the medicines works very well. Viral infection, the role of medicine is less only. You start it early enough in a high risk person, there is a chance of him becoming better earlier. So uniformly, there is no need for everybody to take oseltamivir. We give it for people in high risk, people who have a chance for progression. Otherwise, general supportive care, some kind of salt water gargling, paracetamol, some vitamins should be more than enough. This antivirals decreases the duration of illness in some people who develop problems. It is not mandatory for everybody with flu.
You can protect yourself with a flu vaccine, but experts have suggested that the vaccine isn't as effective against the H3N2 virus because it has an efficacy of only around 33%. So, should you still get the flu shot?
With regards to vaccination, vaccination is very effective, but then you have to vaccinate before the disease. Once you get the infection, you cannot use the vaccine. It has to be only the antiviral or supportive care. So vaccination should happen before somebody becomes symptomatic. That means empirically everybody should be vaccinated by now.
There's another way you can protect yourself, and that's by masking up. You know the drill. Wear a regular 3-ply mask, especially if you're indoors or in a crowded area, or if you're traveling by train or plane. And while cases are rising, the question is, should we hit the panic button? After all, the H3N2 virus has been responsible for one pandemic already in the past.
On the contrary, just imagine if your pandemic comes, at least 30% of the population gets infected. So people born in that time probably have an infection. That's why we probably don't see that many people coming in sick. See, now few things. This H3N2 was in the vaccination. Influenza vaccine is always a group of 2-3 virus-related substances together. So it was in the vaccine, and we've had this before too. So a group of people are already immune to it. Now, the bigger population now who's actually amplifying it is the children, because they are not immune and the immunity is less and they get exposed more. And from the children, adults get it. And the tip of the iceberg, those who are vulnerable get admitted. That's how it goes. So, but we have to remember, every year this happens. Last 2-3 years, because of the COVID, nothing else came up big. Before that, every year during flu season, we used to have patients coming with flu, getting admitted, becoming sick. The same vulnerable group will develop it. One person, another person will come in. So this has been going on. I don't think we should hit the panic button. We should be a bit careful more. First thing, be responsible. If you have cough and cold and sore throat, isolate yourself. The big problem for this is even children go to school when they have a cough and cold, because we forget our responsibility. We want to work, we want to go out. So then what happens? You become alright in 2-3 days. Somebody else becomes sick. First is that. Second, if you have cough and cold for more than 2 days, visit a doctor. He will be able to make a risk assessment and decide whether you need something or not. Third, if you have not had anything, take the vaccine. This is more than enough to control this.
So what is the Union government doing to contain H3N2? The Union Health Ministry said that it is monitoring the outbreak on a real-time basis. It is tracking and keeping a close watch on morbidity and mortality, particularly among vulnerable groups like children, the elderly, and people with comorbidities. The government also said that it expected influenza cases to decline by March end. Several state governments are also on alert. Karnataka has issued a mask mandate to healthcare workers and urged those working in ICUs and isolation wards to take the flu vaccine. Puducherry has suspended school for up to class 8 from March 16th to March 26th to prevent the spread of flu among children. But healthcare professionals like Dr Vijayalakshmi say that it's not just cases of H3N2 that they are seeing. Cities like Bengaluru and Chennai are also reporting many cases of adenovirus, RSV, and metapneumovirus. Doctors also warn that they are seeing secondary bacterial infection post-flu.
Influenza suppresses an immune response. So those who have had influenza infection can develop bacterial infection subsequently. The usual bacterial infection that comes up, the infections are caused in the head, neck, your nose, throat, lungs. So people come with pneumonias, people come with pus in the pleural cavity, people come with bad sinusitis. And this is usually caused by bacterial organisms like Haemophilus influenza, streptococcal pneumoniae, staphylococci. These are the bugs. So some of them have vaccines, some of them have to be treated with antibiotics. So if somebody develops fever, let's say you develop cough and cold, and 2-3 weeks down the lane, you again develop fever, appear sick, please visit the doctor immediately. Don't wait for a week.
We at the News Minute will continue to track the H3N2 situation in India and the southern states in particular. For all the latest updates on the virus and more, do check out our website and subscribe to our YouTube channels. And a reminder, if you value the journalism that we've been doing here at the News Minute, do consider becoming a member. And of course, if you like this video, hit the like button and share this video with your friends.